Tonight, groundbreaking new technology is revolutionizing neurosurgery here in the Valley, giving physicians access to better and more immediate information during surgery. Tonight, one young mother of two shares her experience with a life-threatening brain tumor.
Hi! Did you have fun at school?
You would never guess today that just a few months ago, Jody Ramirez had a brain tumor that left her unable to do even simple daily tasks.
I started noticing my right arm, and I couldn't, write my name right. It was, really sloppy, no coordination. I couldn't brush my teeth, cook, none of those things. And it just got worse for about a month. And then, I couldn't see, and my speech was very slurred. I couldn't walk. It was like I was drunk.
Jody was referred to Dr. Don Myers, a neurosurgeon at Community Regional Medical Center. Although Dr. Myers performed countless operations to remove brain tumors, Jody's case was different.
She was 32 weeks pregnant and presented with headaches, nausea, difficulty walking. They did an MRI scan on her and found a very large cystic lesion deep in the bottom part of her brain.
I was just shocked. I couldn't believe it. I didn't want it to be a brain tumor. And then I got the phone with the doctor, and I just cried with my husband. And I was just so scared. It was really scary.
Within weeks of Jody's diagnosis, community medical centers made a $3 million investment in new imaging equipment that gives surgeons better and more immediate information during surgical procedures like Jody's.
This new equipment basically tells us where we are precisely with millimeter accuracy and allows us to understand exactly where we are in space, in a small hole, inside something. It allows us to understand where our target is, which may be a tumor, and then it helps us to understand where the critical structures are just beneath that. These give us a way to do what we need to do more effectively, quicker, with less risk to the patient. And so they're tools that help us take care of patients in a better way.
Still, Jody's surgery was a risky one. Dr. Myers consulted with her OB/GYN physicians and concluded that Jody would be unable to go through a normal delivery safely.
So she's facing a number of risks. On the one hand, she has her baby. And on the other hand, she's facing the risk that she might not wake up from the surgery, that she might wake up with severe deficits, unable to control her limbs, unable to walk, unable to move about, blind. Anything's possible because the lesion was so deep.
Thankfully, Jody delivered a healthy baby boy by C-section and a couple of days later had surgery to remove her brain tumor. With the new image guidance system, Dr. Myers was able to pinpoint precisely where the tumor was located, and after a 9-hour procedure was able to completely remove it.
She woke up on the table, and the first thing she asked is, was she alive? She says, am I alive? And then she asked, how did it go? And I said, we got it all out. And then she smiled and said, that's good. She's right there on the table about 2 or 3 minutes after she came out of anesthesia, before we even moved her into the recovery room or anything. She was awake, and she was moving everything and doing everything the way she was supposed to. And let me tell you, that whole team, the whole team just went nuts because everybody was so worried for her.
It wasn't long after surgery that Jody began to feel like herself again.
But all the headaches were gone. I could see. It was just back to normal.
For all that she went through, neurologically, when you examine her, you can't pick up any problem. You wouldn't know that she'd had anything done. See you guys tomorrow, okay?
All right.
We'll do it again.
Eat your Wheaties.
I know. Good night.
All right.
What a team. Here on MedWatch, we never tire of hearing about patients like you, Jody. Thank you for sharing your story. If you would like more information about neurosurgery, log on to our website. It's medwatchtoday.com.